Hello, welcome to Podiatry Practice Mastery. Don here. I'm going to talk a little bit about, this is tip number 12 out of 20. I'm getting bored of this, just so you know. I'm going to keep doing it because I have a high follow through. That's something I've learned in strategic coach, and that's one of my downfalls. I have a hard time quitting things that I start. And so I just kind of keep going on stuff. Anyway, 12 out of 20. There's one of the tips I wrote down here was that if someone is in your office talking to you in your treatment chair, they want treatment. And I know this sounds obvious, but many times we think and that like they just want to learn about something. They want to learn, but usually they want some type of treatment done to them. Okay. Let me give you an example. We have a couple of other doctors in our office, and I'm just going to give an example of an ingrown toenail. And this is just my opinion. So they're starting out, and with an ingrown toenail, all they do is I don't even think they trim down the edge. They just kind of take some tape and they pull down the edge of the toenail, and they say that's going to be enough. And then I see these patients back in usually 4 weeks or so, and they say, I want something, I want this taken care of, because it's just this little taping thing that they kind of splint the toenail down on the side, and then I have to do that procedure. Usually I do a IND, or take out just a partial nail avulsion. But there are other things in our office we might do that for. So what patients can get online, they've probably tried, or they've tried ineffectively. Okay, so another example would be plantar fasciitis. If you give them the same stuff that they can get online, like you're going to have to do some stretching exercises, you're going to try an over-the-counter arch support, you're going to try these things. If you're giving them the same thing that they can get online, you're not really giving them anything more, anything added, any treatment, even any better way of explaining it. What is it that when patients come in that you can treat them for? They want their callus trimmed, their ulcer debrided, they want some type of a treatment for their foot, or at least a plan for treatment. That might be shockwave, that might be a diagnostic ultrasound, that might be any other type of treatment that you can do to help get them better. And so I would propose for us that we would treat them do something. They want some type of a treatment or some type of a plan to get them better. Now, if you can't do everything, that's fine. You can use other people. That might be physical therapy. For example, many patients come in with equinus, and certainly they can do foam rolling, they can do a night splint, but then skilled physical therapy is very, very beneficial for them. So doing something for our patients is key in our practice. So that was a takeaway, because I think sometimes I just want to teach them. I just want to come in, I'll just teach them about their condition, what they have going on, and then they're going to love me as their doctor, and that's it. No, they don't want to just be taught. They want you to do something, or at least have a plan for them so that they can get better. Okay. Anyway, that was the thought for today. We're almost done with these 20, and hope the next one is a little bit better than this one. Okay, have a good one. Bye-bye.